Okay, we're on to our next round of local jurisdictions, and we got some women, which is great. Break up this dude fest. We're going to change the order around slightly due to we're running a little bit late, and so there was a scheduling issue. So Cynthia Hogan, who's the chair of the St. John's Hospital Board, is going to go first, and then Dave Adams, and then Kate Mead and Chris. Welcome. In the interest of expanding the idea of one community spanning 2 states and 3 counties, we're super fortunate to have the chair of the Teton County, Idaho School Board with us as well this year. So with no further ado, Cynthia Hogan.
Thank you. So I'm actually going to stick to the 2 questions I was asked today. Put up the first slide. It was really, what are the values? Which I thought, given everything that was happening now, was an excellent question to be asking all of us. And at St. John's, we believe that the values are equally important to an employee's skill level and to their effectiveness. And so when we do annual ratings, we're rating them equally on values and how they're showing and displaying those values, as we are on rating them at the end of the year and the performance on their skill level and their effectiveness. So it's something hopefully we're walking the talk and doing every day. The first value, no surprise, I think, to any of you, for a hospital, obviously, is safety. And the question is, safety has to be the first priority for our patients, but also for our staff and for the entire community. And I think the good news there is that we've been designated the safest hospital in the state of Wyoming by Consumer Reports. Our next values are around character and integrity. And you have to adhere to strong moral, ethical principles, honest business practices, and compliance with the law. There are many other statements under this, but I'm trying to tighten it up for you today. And the questions I'd ask, that we ask in terms of moral and ethical principles is that surgery, is that process necessary? We shouldn't be doing a process on a patient, right? Any step, any procedure, whatever it is, if it's not necessary to benefit the patient. Are our billing experts offering helpful, caring solutions to people who are having problems paying their bills? Those are the moral questions that we're facing. In terms of quality and service excellence, are we responding to the unique needs of each patient? Are we treating them with kindness, with care, competence, and empathy? Nobody likes to be in the hospital, let's face it. But when they are there, do they feel like we care about them and that we're listening to them? Are we investing in staff education? I'd say resounding yes, and the foundation has been very helpful here, with lots of scholarships to help our nurses further their education, internship programs which help high school students get experience in healthcare, skill development, technical proficiency. In fact, we're now rated #1 for joint replacement rehab by the Marshall Steel. And those of you who have had hip replacements, as I have, know that Marshall Steel is really considered the top in orthopedic procedures. In fact, last year, St. John's became one of the hospitals that other hospitals came to visit that were joining the Marshall Steel program, so they could see how far we'd come and what we've learned. In terms of accountability, are we providing cost-effective quality services? For the last 4 years, St. John's has raised the cost of procedures less than the Wyoming average and the national average for healthcare, although we've been investing more in our employees. And so it's a great cost to us, but we think it's important to keep healthcare as affordable as possible because it is so expensive. Are we assuming responsibility for our decisions and actions? So many things in a hospital are done by protocol, but when that nurse is in that room talking with you, she's got to be accountable. She's got to be making decisions in her own mind and thinking through everything she's seeing herself rather than following some rote protocol. And most important here, are we investing in the community by continually improving our services and broadening our spectrum of care? And I'm going to talk about that a lot more in the next slide. And under teamwork, are we collaborating with others for the benefit of all? So think about the flu vaccine this year. When you get the flu vaccine, you're not just doing it for yourself, you're doing it for the community. You're doing it for that 1-year-old kid who's too young to get a flu vaccine, or somebody who's over 65, and if they get the flu, could be truly incapacitated. That's an example of doing something for the benefit of all. The community health needs assessment, where St. John's plays a major role, and is now working with the community putting together the action plans out of the identified needs in the health assessment process. For that, I'll ask you just to go to the next slide. Thank you, Don. So when we look at our values, the question is, how does that really impact us on a day-to-day basis? And that's really where the trustees are focusing in 2018. And John asked a great question. He said, what's flying under the radar? What are things that maybe haven't been talked about in prior meetings? The things you don't hear about in the paper every day that are very important to the trustees. So if there are only two things that you're going to remember from this, aside from the first one, the Driggs is the best economic opportunity. Oh, didn't want to say that. I wanted to say that fiscal sustainability is what enables St. John's to deliver on our values. And in order to be sustainable in this environment today, we have to have a public and private partnership, particularly in rural healthcare communities. There are only 20,000 residents in Teton County. That's not a lot to support a local hospital. But we need a fiscally sound hospital in this community for every single one of us. And some people worry, if we're having a public-private partnership with a lot of support, are we still striving for the highest quality? And my answer to that is a resounding yes. St. John's got 5 stars from CMS. That's the highest you can get for both their living center and for the hospital. And what does this mean? There are about 4,000 hospitals in the United States, and only about 200 of them actually get 5 stars, and we are one of them. And we're really pleased, but that's not enough. We're striving throughout the organization to improve quality further. We're actually going for the Baldrige Award because the process of going for this award, which is something very rare and unique, and probably 1 hospital a year, 1.5 hospitals a year might get it. The process of striving for this award will help us instill quality in every aspect of everything we do. In addition to our high quality mark, we can give loved community services that can only be subsidized if we're fiscally sound. And I say this because so many of the things that we do, that we all love in this community, lose money for the hospital. But they're critical to this community. And we hear through the community needs assessment, and we hear through all of you what is important to you. Just to be clear, I'd like to point out some of them. The emergency room, the village clinic, they all lose money. Athletic screenings for the youth in the high school. The living center loses money. Home health services lose money. Mental health and wellness programs, both within the school system and at the Chamber of Commerce. Our Latino services, and our investment in new technologies that we're making every day. All of these programs have to be subsidized in order to exist in the community so that every one of us or our family members or our loved ones can take advantage of them. The other thing I'd just like to point out is that St. John's hasn't had to ask for additional taxes for operations in over 20 years. Yes, we've asked, and you've been extremely generous in terms of SPET funds for capital expenditures. But in terms of operations on a day-to-day basis, for 20 years, the hospital has been fiscally sound enough to cover its costs. In this healthcare environment, that's not guaranteed. A lot of hospitals, you can just look at Casper, if you don't want to look any further, are really having problems struggling because the revenue pie is shrinking as there's less inpatient services every single year across the United States. There was a brief blip in growth with the Affordable Care Act, but that's over now. Because of that, the second thing that I want you to remember today, if you remember the first was that fiscal sustainability enables us to subsidize those services. The second one is that fracturing services, the services being redundant, impacts our ability to deliver mutual goals that are important to all of us, mutual goals around community health. And the question I'm just going to leave you here is, how do we feel about this? Do we as a group choose to let this happen in Jackson Hole? And I think that's what John was asking today with this meeting. What are our values? What's important to us? And what do we choose? I only have 2 minutes left, so in wrap up, I'm just going to give a brief overview of the Living Center. because we promised to continually get feedback on the Living Center and how we're doing. It's on track. It's a major goal for trustees, administration, staff is here. It's a major focus point. The good news is, with community participation, I see some of the people in this room who are at the meetings. AMD has been chosen as architect. Capella's come on board to help us with a business plan. We're in the rough stage of developing a mission because it's going to be a mission-driven process. And the mission is being now circulated with the staff to get their input. It'll go to the community, get your input. At the same time, we're developing a business plan, and only when that's done can we start to talk more specifically about the number of rooms. And thank you very much for your generous help, because fundraising is on track. There's some very generous donors who have set the lead pace for the community. And with that, turn over to the next person. Thank you.
If you had a one request you could deliver to the Wyoming legislature with respect to health care, what would that be for this upcoming session?
There's so much on the national level that's being done that hurts healthcare and hurts people, but at the Wyoming level, I would really want them to look seriously at the health of our hospitals in Wyoming, not just at Jackson, but across Wyoming, and understand some of the steps that are being taken that are hurting all the hospitals across the state, because I think that would also help Jackson. Competition coming in, fracturing of services, the reduction in funds going to the hospitals, and the need of our patients in the community for all sorts of services, whether it's prevention, whether it's inpatient, whether it's outpatient, and whether it's keeping them in their home longer. So we would really be taking a hard look at those issues. They're hard to understand and trying to understand them.
And with that, we will wrap up this session. I just want to point out that, as I noted before, one of the blessings of living in this region is the quality of the people who are heading up our public agencies. And not only are you guys heading them up, but you're all volunteers. So thank you very much, and please give a round of applause for our panelists.